Okay. Wow, this is quite a party today. We haven't seen this many friends on the call in a while. My name is Stacy Wood. I'm a public information officer with Buncombe County Government. And today we have Dr. Ellis Matheson, the Buncombe County Public Health Director, and Amparo Acosta, who is the Director of Nursing for Buncombe County Public Health. And so the two of them are here today. We invited Amparo to participate because we are very excited to see Patricia on the call today. So thanks for joining us, Patricia. So at this point, we'll have an update from Dr. Matheson, and then we'll open it up to questions from you all. So I'm going to go ahead and mute myself and turn it over to you, Ellis.
Good morning, everybody. As Stacy said, I'm Ellis Matheson, Public Health Director for Buncombe County Health and Human Services. And just a quick update today. We still are at 6 cases in Buncombe County. We have not reported any new cases here in a while, which is great. And we have 0 people in isolation, and we have 83 people who have been recommended to be in quarantine at this time. So happy to answer any questions.
Yes, hi, how are you? Thanks for the welcoming, Ellis. I would like to ask if I'm writing an article about what people need to know about the case in Spartanburg and how that can be related with Buncombe County, the counties like near, well, in this case, Buncombe County, near to, the major focus of the illness in Spartanburg. So, yes, what is the recommendation and what we need to know about that and how that is related with our county?
Sure. Amparo, do you want to answer that, or would you like me to go ahead? Okay. Yep, I'll go ahead. I think, thanks, Patricia, for your question. I think what I'm understanding is wanting to understand how the outbreak in South Carolina impacts us here in North Carolina and what are the recommendations. And so, as you have probably seen, there is an extremely large outbreak right across the border in South Carolina. And they have been seeing about 100 new cases every day. And there is a new dashboard for the South Carolina outbreak. And so I would encourage anyone to go to that dashboard for specific information on that outbreak. And we can put the link to that here in the chat. And so we have had cases here in Buncombe County that were related to the outbreak in South Carolina. The majority of our cases have been linked to the South Carolina outbreak. We have seen one instance of person-to-person spread within Buncombe County. So we know that there can be community spread. I still highly encourage everyone to make sure that they know their immunity status for measles. It's not too late to go ahead and get vaccinated. If you know that you've been exposed to someone with measles or you're having symptoms of measles, which is really high fever, runny nose, red watery eyes, you could have white spots on the inside of your mouth, and then a rash that usually starts at the top of the head and moves down the body to the extremities. If you're having symptoms, please call your medical provider ahead of time. Do not just show up at the doctor's office, an urgent care, or emergency department. We have seen spread to spread with people within the emergency department at Mission Hospital. So that's why it's so important that you call ahead and follow their guidance so that we can reduce exposures to other people. So I really encourage people to focus on making sure they have their vaccination records or have what we call a titer, which is a blood test that shows immunity to measles. And then people who were born before the year of 1957, we do presume that they have immunity to measles because that was prior to the vaccine and most people were exposed and had the disease.
Dry better and prevent clouds. Bring a little sweat shot. How's that foothold?
So our friends from WIFF, do y'all have a question? You came off of mute. Okay, are there any other questions from media partners on the call?
Hey, it's Helen. I'm just wondering what kind of this is great news that things are kind of holding steady. So at this point, what are conversations like? Is it, do you just, are you, at what point, how long will it take before you feel like either it's behind us or it's in a different situation? Is this kind of give us a timeline of what you're looking for?
Yeah, that's a great question, Helen. And I would once again point people to South Carolina's dashboard, and you can see the timeline of how this outbreak down there has progressed. And you can see that it started out small, sort of month to month. There was a smaller number of cases. And then at the beginning of January, this outbreak just really took off. So just because we have not had any cases here in the last week or so does not mean that we're out of the woods. Once again, we know we have pockets where we have lower vaccination rates, and you've probably heard the analogy that there is a wildfire burning in South Carolina, and so those embers could be flying into North Carolina, and those pockets of areas where there's low vaccination rate is tinder for that fire. And so when those embers come over, it really could result in a wildfire starting to spread here. So we really still have to be paying attention. And once again, that's why I really, really encourage everyone to take this seriously and know your immunity status. If you need to get vaccinated, please come see us at our 40 Cox Avenue Immunization Clinic. Give us a call, 828-250-5096. We can help you find your immunization records. We can get you the vaccine if needed. And then, of course, please remember to call ahead if you're having symptoms.
Thank you.
Ellis, I see a question in the chat from WIFF. Good morning. I had a question about the spread and previous concerns about shelters before the winter storm last week. I wanted to know if there are any procedures to limit spread in shelters with another storm approaching.
Yeah, thank you for that question. And yes, we have been partnering with some hotel businesses within our county, and we have a process and a team in place so that if people who are in quarantine, who should not be in general population shelters, needed sheltering during the storm, they can work with one of our staff members, and we will make sure that they get into appropriate sheltering during the storm so that people are safe and have their needs met and not exposing others.
Yes, I have a last question because as you mentioned, there is lower vaccination pockets. Can you tell more about that? If you're referring in pockets in our county, if what we know about this, like pockets with lower vaccination rates?
So can you repeat your question? I'm sorry, I don't think I heard it or understood it.
Yes, sorry. And you mentioned it that there is lower vaccinations rates pockets. Can you tell us more about those lower vaccination like places or pockets in our county? What we know about this? If you're referring in some certain like communities or parts of the county?
Yeah, so North Carolina Department of Health and Human Services has two different dashboards around vaccination that people can go look at, and you can drill down to the county level. And one of those dashboards is around the vaccination rates in our schools. And so people can also drill down specifically to schools and see what the vaccination rate is for specific schools. And we do need to have 95% of people vaccinated to really have that good community immunity, or you may have heard the term herd immunity. And so you will see that we do have some schools that are well below 90%, definitely below 95%. And so I would encourage people to utilize those dashboards if they have questions or want to understand about different schools and their vaccination rates. I see another question from WYFF saying yesterday, South Carolina Department of Public Health shared in their briefing that the outbreak in South Carolina was not a multi-state outbreak at this time. At what point do you believe it could evolve to that in North Carolina? And what help has North Carolina Department of Health and Human Services been able to provide to Buncombe County? Yeah, so currently we're not seeing lots of spread from person to person within counties across North Carolina, and so that's why it hasn't been deemed as an outbreak. We have seen one person to person spread here in Buncombe County, and our partners at North Carolina Department of Health and Human Services are wonderful. We are in contact with them almost daily. And so really having that communication with them has been vital in helping us provide guidance. And also working with other counties surrounding us who have also had cases. So there's lots of lessons learned, and we can make sure that our guidance and communication is, sort of standard across different counties, because our public health system in North Carolina is different than South Carolina in that we are a decentralized public health system. But we have a wonderful relationship with our state partners as well as partners in different counties across the state.
All right, any other questions? Patricia, can you stay on the call? If there are no other questions, we'll go, okay, we'll go ahead and wrap it up. Thanks for checking in with us, and we'll continue to keep you all posted about our cadence. We might be scaling these calls back just depending on the need. We just wanted to touch base with you after kind of all the weekend winter storm events and stuff. So we won't hold one tomorrow, but we'll be back. We'll communicate via press release about immediate availability next week. And just so you know, we will be available if something does happen. But for planning purposes, we won't hold another one until next week at some point. So thanks again.
Thank you all.
Thank you.
Hey, Patricia.
Hi, how are you?
Hi, good. I just wanted to see if you were interested in speaking with Amparo directly in like a